we just really wanted to protect all of the residents. It was like our #1 priority were the residents.
Quebec seniors' homes were the hardest hit in the pandemic, accounting for about 80% of COVID-19 related deaths in the province. But here at Camille Lefebvre Pavilion, a long-term care facility which is part of Montreal's Lachine Hospital, not only were there no deaths linked to the virus, there hasn't been a single positive case within it.
We knew that if there was one case with the ventilated patients, we would be finished. So we were really vigilant.
At the 135-bed facility, 18 seniors live on ventilators full-time.
They need a lot of care. So it's important for us to make sure they're not catching it, because it's going to be awful, very miserable, and the staff was very worried.
A team of managers developed an action plan back in January before the first case of COVID-19 was even declared in Quebec. And in March, when the province shut down, they already had strict guidelines without waiting for government directives.
March 14th or March 15th, whatever that day was, our plan had started the Friday before, and by Monday morning, no more visitors.
And we did have employees who, because of the break in March, who went back in their family in Europe. So as soon as they arrived here, they did not came to work, and we quarantined them at home for 14 days just to make sure.
And we met with the staff. Do you work elsewhere? If you work elsewhere, you have a choice of working either with us here or you stay with your other employer, but we didn't want the employees to work at both places.
At the height of the pandemic, this was a major problem. Thousands were working part-time at more than one long-term care home, leaving many seniors' homes critically understaffed. At Camille Lefebvre, part-timers were offered full-time work to limit their exposure. Between 10 and 15 staff members did test positive for the virus, but did not transmit it to patients.
They followed the rules. They wore their masks, they washed their hands, they washed the surfaces.
In a statement, the ministry responsible for seniors and informal caregivers says, "We are in the process of training 10,000 people to work as orderlies who will be ready in the fall. These additions will put an end to employee movement between different residences. When it comes to supplies and protective equipment, we are ready." The staff at Camille Lefebvre says they're ready too.
We will do exactly what we had to do. We might have to stop the visitations. We're going to still filter the employees. Anyone who has symptoms, if patients or the staff has symptoms, we're going to test them, and we're going to follow the recommendation from infection control.
In Montreal, Alicia Rubertucci, City News.